Hello, I've prescribed Meloxicam as part of your pet's post-operative pain management protocol. Meloxicam is a non-steroidal anti-inflammatory drug that goes under the brand names of Meloxicam or Rumicam. We dispense Rumicam. Depending on the size of your pet, you'll either be dispensed the Rumicam in its original packaging, like so, or if you have a very small animal, we may be giving it in a smaller dropper bottle. Now the product is actually a cloudy white color. I've dyed it green just to make it easier for you to see as I'm loading the syringe and giving you instructions on how to measure the dose. With a larger dog, with the original packaging, you're going to take the child-proof cap off, and the product comes with a syringe, and the syringe is marked in kilograms of body weight. But what we've done is we've put a black line on the syringe barrel to show the correct volume for your dog. So you don't even have to worry about how much your dog weighs. We've taken care of that. We've put the line on the syringe to show you how much to give. So in order to get the product into the syringe, you put it into the orifice at the end of the bottle and pull down on the plunger until you've filled the syringe. Then push the plunger back up to squirt the excess drug back into the bottle until the plunger meets the black line that we've put on there, and then take that off. Now what we suggest is that you take this quantity of liquid, squirt it onto a piece of bread and let it soak into the bread, and give it to your animal as a treat, because this is a liquid oral medication, but one of your important instructions is you're not to touch your animal's mouth at all for 14 days. So we don't want you trying to squirt this drug directly into the mouth. We want you to put it on a piece of bread, let it soak into the bread, give that to your pet as a treat. If the bread itself isn't enticing enough, feel free to add some peanut butter or cream cheese or something to entice your dog to eat the bread with the drug in it. If you have a much smaller dog and we've sent home the small bottle, then what we've done is taken the end of this tip and cut it down in size so that this syringe will fit neatly into there. And again, we've put a black line on the syringe to show you how much liquid to draw up. So as with the other, you just overfill the syringe, then squirt back into the bottle until the plunger meets the black line on the syringe. And then that's the quantity of drug that you squirt onto the piece of bread, and give that to your animal as a treat. If you have concerns that your dog won't eat bread or is not allowed to eat bread, give us a phone call and we'll talk to you about other delivery options, other ways of getting the Meloxicam into your pet without having to handle the mouth. Now this Meloxicam is a once-a-day treatment, once every 24 hours. We will have given the first dose prior to discharging your animal, so the next dose will be the day after you get home, and those instructions will be on the discharge statement that you'll receive by email and in the report that we'll be sending you. One other thing about non-steroidal anti-inflammatories, they do have the potential to cause some digestive upset, so if you're seeing any concerns with that, any vomiting or diarrhea, contact us before giving the next dose. And really, as with all medications, if you have any questions or concerns, by all means, get in touch with us. Thank you very much.